Hi, my name is Glen Crum, and I'm doing a health history for an advanced physical assessment class at Robert B. Miller College. And this is Shannon, and she will be playing the part of the patient, and I'm Glen, and I'll be playing the part of the provider. So, hi, my name is Glen. I'll be
Hi.
your provider today. How are you?
Good, thank you.
Um, we'll be doing a health history, which takes about 20 to 30 minutes.
Okay,
Is it okay if I call you Shannon?
that's
And
fine.
can you tell me your date of birth?
1/24/1980.
Okay. Now, can you tell me what brings you in to the office today?
I'm having an IBS flare-up.
Okay. And how long has that been going on?
About 2 weeks.
Okay. And how long have you had IBS?
I was originally diagnosed in 2002.
Okay. Now, can you tell me um, what the location is that you're having a problem?
Just all over in my stomach.
All over in your stomach. Okay. Can you tell me, describe would you call it pain?
Yes.
Okay, can you describe it? Is it burning, sharp, dull, aching, gnawing,
Crampy and achy with some sharp pain.
with some sharp pains? Are they occasional?
Yeah.
Okay, so it's not always a sharp pain.
No.
Okay, now the if you had to put it on a scale of 0 to 10, 0 being no pain and 10 being very terrible pain that, so uncomfortable that you're about to pass out from pain, where would you rate that on a scale
I'd say
of 1
it's
to
been a
10?
pretty consistent 6.
Okay. Um, so what is the worst it ever gets?
The worst it's ever
Or
been?
that it gets during this episode?
Oh, probably a 6.
Okay. All right. And what's the best it ever gets?
A 5?
Okay. Now, is there anything that relieves it, makes it better, like rest, medications, ice, positioning, something you eat?
Not really.
Not really. Okay. What makes it worse?
Eating
Eating,
and any kind of pressure or physical touch to the stomach
touch toes.
area.
Okay. Um, did you have any family history?
My mother has IBS as well.
Okay. Um, is there anything that you can't do right now that you could do before related to this?
It's causing some problems at work as far as being able to hold the children, lift the children, and
Okay.
just physical activity in general.
Okay. Is there anything that goes along with it besides the pain in your abdomen?
I get severe heartburn.
Okay.
I have severe heartburn.
And is that pretty consistent or?
Yes.
Okay. Do you have any problems with diarrhea or constipation related to it?
Yes, back and forth with both.
Okay. We'll get more into that here in a minute. So, if you could, what would you consider your normal health state to be, your usual health state?
Healthy, very healthy.
Okay. But you have these flare-ups of the IBS.
I do.
Okay. And who do you consider to be responsible for your health?
Myself?
Oh, okay. So not like your mother or
No.
me or anything.
No.
Okay. Um, um, what would your ethnic background be? Your cultural?
Caucasian?
Okay, no specific European ancestry or.
Mm,
Okay. What expectations do you have about your health care
Today?
in general and related to the IBS?
Just hoping to be able to find a way to alleviate some of the pain and the heartburn, get back to regular daily
Okay, good.
activity level.
We'll do the best we can. Now, let's talk about your health history, your childhood illnesses. Did you ever have measles,
No.
mumps, rubella,
No.
chickenpox?
Yes,
Okay, did you know about when?
about 87.
Okay, so you're about 7 years old. Okay, pertussis or whooping cough,
No.
strep throat.
Frequently as a child.
Okay, at about what ages?
Excuse me. I would say frequently probably from 8 to 12, and
Okay.
then less frequently through the teenage years, and as an adult, rarely.
Okay. Any rheumatic fever?
No.
Scarlet fever?
No.
polio.
No.
And then as an adult, you've had the irritable bowel.
Yes.
Anything else significant?
No.
No? Okay. Um, have you ever had any injuries, accidents,
No.
broken bones, anything like that?
No.
Have you had any hospitalizations?
No, I've been to the ER for the IBS, but not admitted into the hospital.
Okay. Have you ever had any procedures or?
I've had 3 colonoscopy and upper GI scopes done for the IBS.
They did both at each time?
They did.
Okay, and when did you have those?
I had the first one done in 2002, and it was done in Kalamazoo.
Okay.
And the second 2 were both done in 2010.
Okay.
One at Oakland and one at U of M.
Okay. And no conclusive findings from that, or?
No. No,
Okay.
they said everything was normal.
Okay. Do you have children?
I do, 2.
Okay. And what are their ages?
5 and 6.
Okay. So you had just the 2 pregnancies?
Yes.
So you've never had a miscarriage or abortion?
No.
Okay. And did you have a normal course of pregnancy?
Yes.
Okay. And if I can ask, while you were pregnant, how was your IBS?
It was great while I was pregnant.
Now, are you up to date on your immunizations?
No.
No? Okay. Did you have immunizations as a child?
Until about the age of 12.
And what made you stop?
I had some autoimmune diseases as a young teenager, and so the doctor and my parents thought it would be best for me not to receive the shot at that time.
And what was the autoimmune disease?
Epstein-Barr and chronic fatigue.
Okay. So you also had Epstein-Barr and chronic fatigue as a child?
Yes.
Okay. Now, do you immunize your children?
No.
No? Okay. Make sure you always discuss that up front with your pediatrician.
Okay.
Do you have any drug sensitivities or allergies?
I'm medication sensitive.
Okay, so even low doses affect you, basically.
Yes.
Okay. Any food intolerances?
Lactose intolerant.
Okay. No food allergies besides that?
No.
Does it just make you sick to your stomach? Make probably the IBS worse. Okay.
Right.
Any allergies or reactions to dust or mold?
No.
Any physical contact with anything like latex bother you?
No.
You ever had allergy testing?
Yes.
Okay, and what did that show?
Everything was normal.
Okay. Now, did you bring in your medications?
I did.
Okay, now we wrote those down. You take a multivitamin every day.
Yes.
A B12 vitamin.
Yes.
And a calcium vitamin. And also Prilosec twice a day.
Twice a day.
And if I can tell you, because you also wrote down in the questionnaire that you were a vegetarian, so instead of just taking the B12, you might actually want to take a B complex vitamin.
Okay.
Okay. And you said that you had taken Ultram, Bentyl, Promethazine, and Zofran in the past for the nausea.
Yes.
And also
for the IBS.
birth control for the IBS, and none of those you found to be helpful. From what you had said, is that you still feel the same way? None of them showed nausea relief? Okay. Well, sometimes if something doesn't work, you can feel like it's not worth taking. So let's talk a little bit about your family history, and these would be your blood relatives, like your parents, grandparents, siblings, and your children.
Okay.
Do you have any history of heart disease in your family?
Yes, my mother's father passed from congestive heart failure.
Okay. At what age?
Early 80s.
Okay. And then high blood pressure?
My father's side all has it.
Okay. And at what age does that usually?
40s or 50s.
Okay. And then history of stroke?
My father's mother had multiple strokes in her 70s.
Okay. Did she pass away from that, or is she still living?
No, she passed away, but not from the strokes.
Okay. What did she pass away from?
Cancer.
Cancer. And then any history of diabetes?
My mother's father had diabetes.
Okay. And do you know if he had type 1 or type 2 diabetes? Like, did he have diabetes from
He
childhood?
developed it later, I would say, in
Okay.
his 70s.
Okay, so he was a type 2 diabetic
Mm-hmm.
then. Okay. Any history of blood disorders? Um, like bleeding disorders, hemophilia, any blood cholesterol issues?
My father's side has high cholesterol.
Okay. Um, Now, what about breast cancer?
My mother's mother and all of her sisters have all had breast cancer.
Okay. Um, what about at what age did they develop breast cancer?
I would say late 50s and in their 60s.
Okay. Now, any other cancers?
My father's mother had skin cancer, and she passed away from intestinal, bowel, liver.
Colon cancer?
It was kind of everywhere
Okay.
when they found it.
And at what age did she pass? Do you know about?
I think she was 74.
Okay. Um, do you have any history of sickle cell anemia?
No.
Arthritis?
No.
Allergies?
My son has allergies and he's asthmatic.
Okay. What allergies does he have?
Tree nuts, peanuts, seasonal horses, and cats.
Okay, that's a lot.
It's a lot.
Do you carry EpiPen?
We carry an EpiPen
Good.
and a hand inhaler.
Okay. And you said he had a history of asthma.
He does.
Any history of obesity in
No.
your family? Alcoholism?
No.
Mental illness, even depression, anxiety, bipolar disorder?
No.
Okay. Seizure disorders?
No.
Kidney disease?
No.
Tuberculosis?
No.
Okay. Thank you. Now, did you graduate from high school?
I did.
Okay. Did you go to college?
I did.
And what did you go for?
I'm a doula.
Okay.
A birth assistant.
Okay. Awesome. And what do you do now for work? Do you work as a doula?
Right now, actually, I'm a nanny.
Okay. How long have you been doing that?
With this family, I've been with them about a year.
Okay. And do you do okay financially with that?
Mm-hmm.
Okay, good. And you get along good with you probably don't have coworkers. It's
No.
probably the boss, the parents. And you're satisfied with your job?
Absolutely.
Okay, awesome. Do you have any kind of specific religious or spiritual beliefs?
Christian.
Okay. Do you go to church and everything then?
Yes.
Okay, good. Does that play into your health care in any way?
Yeah. Yeah, we use prayer a lot.
Okay, good. That's good. Do you get routine healthcare exams?
Yeah.
Like every year?
Mm-hmm.
You go to the dentist?
Yes.
Get routine dental exams? You mentioned that you are a vegetarian, but do you eat eggs?
Yes.
Okay, so you're not a vegan, but you're a vegetarian.
Mm-hmm.
Okay. Can you tell me what you had to eat today?
I had coffee and banana and dry cereal.
Okay.
And small salad for
Okay.
lunch.
Okay, so that's pretty good then. Um, do you follow any kind of an exercise pattern?
I run.
Okay, good.
I run after children.
Okay, that counts. Do you smoke or use tobacco
No.
in any way? Any alcohol?
No.
Any street drugs, other substances?
Mm-mm.
No marijuana, cocaine?
No.
Nothing like that? Okay. Do you perform a self-breast exam?
Yes.
Okay. How often do you do that?
Monthly.
Okay. Do you also get a yearly pass on that?
Yes.
Okay. Excellent. How are your sleep patterns?
They're not great right now, I guess.
Do you try anything to help with sleep?
Chamomile tea sometimes, or just
Yeah.
Just trying.
Just trying. Okay. Do you drive?
Yes.
Do you always wear your seatbelt when you drive?
Yes.
Okay, excellent. Do you ride a bicycle?
I think you should.
When you ride a bike, you should always wear a helmet. Even if you're afraid you'll look silly, you should still teach the children to do so as well.
Right.
So all in all, do you feel like you try to lead a pretty healthy lifestyle?
Yes.
Okay. Now, I have to ask you some questions, and they kind of come across a little strange for a lot of people, but try to understand that we just have to ask everyone these questions.
Okay.
So violence is very common in today's world, and it can overlap into our homes. And because violence affects so many people, I now ask all my patients a few questions about violence in their lives. So I have to ask, are you married?
Divorced.
Divorced, okay, but are you seeing anybody right now?
Yes.
Okay. So all couples argue now and again, even the best of couples. And when you and your partner argue, are you ever afraid of them?
No.
No? Okay. When you and your partner argue verbally, do you think he tries to emotionally hurt or abuse you?
No.
Does your partner try to control you?
No.
Okay. Does your partner or anyone, or has your partner or anyone ever slapped you, pushed you, hit you, kicked you, or otherwise been physically hurt
No.
you? Okay. Has your partner ever forced you into sex that you did not want to participate in?
No.
Okay. Thank you for that.
Mm-hmm.
Have you had any major changes in your life recently?
No.
Okay. Have you had any current stressors that are abnormal for you?
No.
Or do you deal with stress okay?
Yeah.
What types of things do you do?
Talk about it, pray about it, and
Do you have a support system?
I do.
Who would you consider your support system to be?
My family and my boyfriend.
Okay. Good. Um, do you live in a house or an apartment?
A house.
Okay. And you don't have any problems with heat or light or
No.
noise pollution there? Anything
No.
unusual? It's a normal setup for
Mm-hmm.
you? No problems with transportation?
No.
Crime in your area?
No.
And no hazards with your job at the
No.
house? You take care of the children at the house?
Yes.
Okay. Now we'll just do a little bit of a review of your systems here.
Okay.
It'll kind of help to identify things that we might have forgot to touch on.
Okay.
So with your skin, do you have any rashes, nodules, lesions, infections,
No.
allergies, color changes, changes in moles, texture, itching, nail changes, hair distribution changes?
No.
Do you have tattoos?
I have 2.
Okay. Do you have any piercings?
My ears.
Okay. Related to your eyes, do you have any, you wear glasses, I see.
Mm-hmm.
Do you ever wear contact lenses?
No.
Do you have any eye pain, changes in your pupils, blurring, swelling,
No.
itching, watering?
Some itching and watering just due to seasonal changes and lack of sleep, but otherwise normal.
Burning?
No.
When you had your last eye exam?
About 6 months ago.
Okay. Um, any problems with your nose and sinuses,
No.
your ears, frequent cold, allergies, nosebleeds, sinus pain, obstruction, change in your sense of smell,
No.
ear pain, infections, discharge, ringing in the ears, vertigo, or hearing loss?
No.
Okay. With your mouth, throat, and neck, any pain, difficulty swallowing, difficulty chewing?
Sometimes you have difficulty swallowing due to the heartburn.
Okay. Yeah, that would make sense. Cold sores, bleeding gums, hoarseness,
No.
altered taste, swollen lymph nodes or goiter?
No.
Lymph nodes are here. Okay. Related to your breast and underarm, any lumps, nipple discharge, pain, dimpling, tenderness, swelling in the underarm?
No.
Your respiratory system, any pain, in your lungs?
No.
Coughing up blood, unusual breathing through the mouth, cough, wheezing? You ever had a chest X-ray?
Mm-hmm.
And what was that for?
I had the flu, so they just when I went in, they didn't know what it was initially.
Okay, so no significant abnormalities?
No.
Okay. Related to your heart and your blood vessels, any chest pain?
No.
Palpitations like fast beating of the heart, unusual beating? You ever been told you have a heart murmur?
No.
Swelling of the legs or ankles or feet?
No.
Unusual blood pressure?
No.
Calf pain?
No.
Fatigue?
Some fatigue with the IBS.
Okay, that would make sense. Coldness and numbness of the hands and feet?
Yes, actually, it runs in my the
Coldness.
women in my mother's side.
Okay. Ulcers of the feet?
No.
Varicose veins?
No.
Anemia?
No.
Bleeding tendency?
No.
Bruising?
Not excessive.
Okay. Do you know your blood type?
No.
Okay. And I would say related to the coldness in your hands, if you'd always make sure that you get your thyroid checked.
Okay.
Okay, and we talked a little bit about your GI system.
Mm-hmm.
Your changes in appetite, the appetite goes down, you said, when
Yes.
your IBS is in a flare-up.
Mm-hmm.
And you have some weight loss.
Yes.
When you don't eat for long periods of time related to it. Um, and then you steadily gain weight afterwards. Is that at least a little bit?
Yeah.
Okay. And then you said you had back and forth diarrhea and constipation.
Mm-hmm.
Do you have any problems with gas?
Yes.
Okay. Do you take anything for that?
You just somebody telling me about that.
Okay. Okay. Does that help you some?
Mm-hmm.
Okay.
Seems to.
Good. Any problems with do you have to use any kind of laxatives or antacids?
Sometimes.
Okay. Now what do you use?
Just Tums or Rolex for antacid and normally Miralax for.
Okay. So Miralax is another.
Mm-hmm.
Okay. Do you use that every day?
No.
Okay. Just, if you don't have a bowel movement for 3 days, you're going to want to try to increase your fluids.
Okay.
Um, Make sure you're getting enough fiber. Some people do good with prune juice. Some people do good with just a hot liquid, some maybe your chamomile tea or, even coffee. But be careful because coffee can kind of excite the GI system too.
Okay.
But the Miralax would certainly be good. Even if you go for a day and a half or something, and you're feeling a little full, I would go ahead and start trying to use that and just use it daily until it produces a bowel movement.
Okay.
Now, if you're on the other end of the spectrum and you're having problems with diarrhea, I would say make sure you're getting enough fluid, first of all. Some people do good with like the sports drinks, that kind of thing, which has some sugar as well as some, electrolytes in it. But, a lot of times I'll tell people to do some kind of broth, but, most broth has meat in it, and with your vegetarian um, diet, you might want to try some kind of a vegetable broth. And I would say to alternate between, something like a vegetable broth, just plain water, and then something that has a little bit of sugar in it. And maybe incorporate some chamomile tea. And I would probably myself add honey to it, because honey is a very easily digestible sugar.
Okay.
Just make sure you're getting enough fluid in that period of time. Now, you never had bloody or tarry stools?
No.
Okay. As far as the genital urinary system, do you ever have any pain, burning, or frequency?
No.
Increased urination at night? Retention of urine?
No.
Do you feel like you're not fully emptying?
Mm-mm.
Changes in the color or odor?
No.
Genital discharge?
No.
And infections or lesions or pain?
No.
Okay. And you still menstruate?
Yes.
Okay. And how long is your cycle generally?
About 4 days.
Okay. Any problems with premenstrual syndrome, PMS?
It can bring on IBS.
Okay. Does it put you into an episode? Or
It can.
Okay.
Mm-hmm.
And you said that you had taken the birth control before, but you didn't seem as if it really helped you much.
When I was younger, it seemed to help, but as I've gotten older, I don't feel like it's quite as effective.
Are you pretty regular on your cycle?
Mm-hmm.
Okay. Musculoskeletal system, any problems with pain or swelling, stiffness in your joints, muscles, bones, deformity, limited range of motion, like you're not able to move all the way through the normal movement of an extremity, any weakness,
No.
problems walking?
No.
Okay. As far as your nervous system, endocrine system, any problems with fainting, dizziness, seizures, unusual sensations, pins and needles?
No.
Memory changes, headaches, mood changes, depression?
Some depression when the IBS is real bad.
It's not something that lasts longer than the symptoms?
No.
Okay. Hallucinations?
No.
Increased thirst?
No.
Increased urinations?
Mm-mm.
Tremors, changes in temperature, sensitivity, like you're intolerant to cold or hot?
When the IBS is flared up, yeah, to both hot and cold.
Voice changes?
No.
Changes in your glove or shoe size?
No.
Excessive sweating?
No.
Okay. Well, I thank you. Let's give a little summary here. So we have Shannon, who is a 32-year-old female who comes in with an exacerbation of irritable bowel syndrome, which she has had since 2002. This current exacerbation has lasted about 2 weeks. She's having pain that's a 6 out of 10 consistently. The best it gets is a 5 out of 10, which she describes as cramping and aching with occasional sharp pains, which is made worse by eating and any kind of pressure on her abdomen. Her mother also has IBS since 2002, and the pain, which also has some heartburn associated with it that is severe and constant, is affecting her ability to do her normal physical daily activity. She is otherwise fairly healthy. Um, what I recommended for her to do at this point so far is, because she is a vegetarian, she was taking a B12 supplement. I recommended that she takes a B complex, and you know, I also recommended just ways to balance her diarrhea and constipation with making sure she gets enough fluids, and takes her Miralax which she takes PRN when she's having problems with constipation. She has taken in the past Ultram, Benzoyl, Promethazine, and Zofran, and birth control pills in relation to the nausea and to the IBS, which she finds to be unsuccessful historically. Um, she works as a nanny, and it is starting to affect her ability to do her job. So hopefully we can try to make this more manageable for her.